Okay, thank you. Good morning. Um, for those of you who this is your first IAS-USA conference, welcome, and to the rest of you, welcome also. I'm sure a lot more people are going to be coming in as we proceed through the morning. I'm Jeff Lennox. I'm a professor here at Emory University, and I work in the Ponce de Leon Clinic and at Grady Memorial Hospital. And I'm one of the co-moderators for the meeting today. And then my colleague, Dr. Michael Sag, from the University of Alabama, is the other co-moderator. And this is the 31st, or I guess it says 30, but I could have sworn it was 31st meeting here in Atlanta. And it's good to have everybody here, and we're glad to see you all. And this is the slide, obviously, you can see us. So there were 180 people registered, and you can see that there's a wide variety of states that people are attending from. And that's one of the strengths of our regional course here in Atlanta, is that we do tend to cast a wider net than some of the other courses that are put on by the International Antiviral Society, USA. As part of this, we do a pre-test to see how people do on the answers. Y'all didn't do too good. But that's good. So there'll be some learning occurring today, and hopefully throughout the course of the day, you will hear the answers to the questions and you'll show an incredible improvement on your scores. Now, I'm sure the 43 people that answered were people who were very willing and going out there, so maybe all the rest of you were sort of sandbagging and waiting to see the information first. The IAS-USA offers CME credits, and you can see the full amount of category credits that are available, and that you can claim the CME credits. It's also good for the ABIM mock points for those that are maintaining their certification, nursing contact hours, pharmacy credit, and as you can see on the slide. So please, as part of this, usually you have to fill out your evaluation of the meeting, and then it should be fairly easy to claim your credit. The IAS-USA is not a for-profit company, and it does accept support from certain pharmaceutical manufacturers and others to help pay for the costs of meetings like this. And you can see who our platinum supporters are here, and then the bronze supporters, and they have no influence over the content of the meeting. There has not been any collaboration other than their willingness to provide support for making sure that the meeting. I want to thank our supporters for this conference. Financial relationships, you could find the financial relationships for each of the speakers within the website. The presentations will be available afterwards, so any of you who have ever come here in the past, you will have access to our presentations after the meeting. Now, we're using a new method this year called Slido for our slides, and we're also going to be having you do questions. Oh, I just waved it, I didn't mean to hit it. But anyway, you can see here that when a question comes up, and I hope everybody's used these QR response codes now. They're prevalent throughout our society, and that will lead you to the poll, and then you can participate. Why don't we go ahead with this? And then those of you who are interested, if you look in the upper right corner, you should be able to see how many people have answered. So we'll just wait a few 30 seconds or so. We hit 60. Okay, there we go. This shows for the people who were able to enter their answer. And this has been fairly consistent over the years here in Atlanta. We have about equal numbers of physicians, nurse practitioners, physician assistants, and other advanced practice providers. a fair representation of pharmacists and nursing professionals. So thank you, everybody, for answering that question. Now this one, now that people have gotten the first question, this should go a little bit faster. How many individuals are currently under your direct care for HIV? Go ahead and move forward. So, and again, this is, I think, is fairly representative of what we've seen in the past, that the majority of people are caring for a large number of patients and are actively engaged in the care of HIV. But there are obviously some people that don't have as much experience, which is also perfectly acceptable. We'll be updating you throughout the day on the latest developments in several areas. So if there are any infectious disease fellows in the audience, if we could have you stand up, since you will be inheriting the mantle from all of us old fogies up here in the near future. Are there any fellows in the audience? I don't see any that I recognize. Okay, well, if they come in, we'll give them a standing ovation as they enter the room. They'll wonder what the heck's going on. Okay. So this is the morning agenda, and hopefully everybody's familiar with it. And as you can see, we've got a full agenda with a lot of really interesting talks and excellent speakers.